My presentation is over the medication RU486, commonly referred as the Mifepristone. It can assist a person who's had a miscarriage to be able to push everything that remains in their stomach if it hasn't came out, if there's anything lingering in there. And it can actually assist them instead of manually being having a surgery to remove anything manually. This can be effective to be able to push everything out instead of going to that extreme. It can assist in labor as well to induce a woman who's about to go into labor or needing to go sooner than their delivery. It can assist also in the transition of relieving stress for a fetus during labor as well. It is cost effective, it's affordable, it's effective compared to other drugs, and it is pretty available. And it's been legal for at least 20 years within the US, but there are some countries or places that do not allow the use of it because of the misuse and the bad reputation it could have for people. It also, on a plus side, lowers the side effects of birth defects when used properly for a baby. Cons. Well, obviously, there's always a good and a bad side. The bad side to it is when it's misused, there's a lot of effects. It can lead to hemorrhaging. It can lead also to deformities when it's given in high dosage to the fetus and a baby once it's born. But it can also help on a good note with the hemorrhaging if given a proper dose. So there's always a good and a bad side to it. I think this is something that's misused and given a bad reputation. It's not necessarily bad, but there's always that one that ruins it for the rest of us and gives it a bad name because of the misuse or overuse, and not enough knowledge is given, or they just plainly don't care. But when given properly and with a mix of other medications, it can lead to positive results and effective results for doctors and patients when safely given and used. I do believe it is helpful, especially when you have a situation where there's a lot of stress on a baby during delivery. It's sometimes a tough nut to crack, as they say, because it can be normal for one person as far as their delivery, and it can be difficult for another. Every patient isn't the same. Every delivery is not the same. Maybe you have groups, but it's not necessarily a smooth sail for every single patient and baby upon their delivery. So if it's something that's given properly and effective and leads to a healthy baby, I don't see why it would be necessarily something that would be bad. But it is also known as a medication that they give at places like Planned Parenthood, where they do allow abortions, and this is specifically the medication that they use to administer abortions and purposely push out a fetus that women do not want, and when they want to terminate the pregnancy, unfortunately, which is also given properly in that sense, but for that purpose. So obviously there's a lot of controversy over that alone, that situation as far as abortions. So when you're speaking on that medication, it gives it a really bad image. But that's something that I learned with this class specifically, the fact that there are things that are used like this in a positive way, which I would have never thought just because it's used for an abortion, that you could use it properly where it's a benefit to yourself and a baby as well during a delivery for any woman. When it's given in a high dose, it can lead to maternal fever, chills, abdominal pains, nausea, vomiting, diarrhea, and it can pose various risks to the mother and the fetus. Significantly, all in all, anything that's used properly can be used effectively and positively as well. In my personal opinion, it doesn't necessarily have to be given an entirely bad image. So for me, I would say that I am on the side of this type of medication. I've never had an abortion, but it ultimately, like, I can relate to the situation unknowingly before this class because I didn't know, but they gave me this type of medication. But this is not necessarily something that's bad, but when you have unforeseen circumstances and it's given properly and used correctly, it can be used effectively.